Okay, let's unpack this. Today, we're doing a deep dive into veterinary interstitial pneumonia.
Yeah, and we've got some really detailed source material that you shared. It gives a proper expert look at this, well, pretty complex lung condition in pets.
Right. So our mission today is really to be your guides through all this information.
Yeah.
We want to pull out the absolute most important bits, the surprising facts, maybe even some sobering ones,
Uh-huh.
about what this actually is, why it happens, how vets figure it out, and what can realistically be done.
Exactly. Think of us as navigating this expert source together. We'll highlight the crucial points so you can walk away feeling informed, but without getting bogged down in every single technical term.
Perfect. So let's just jump right in. At its heart, what is veterinary interstitial pneumonia?
Okay. So it's a specific type of inflammation in the lungs. You might think of pneumonia as just fluid or infection in the air sacs themselves.
Yeah, that's the usual picture.
But with interstitial pneumonia, the inflammation is actually happening within the walls of those tiny air sacs, they're called the alveolar wall, and also in the supporting tissue space between them, the interstitium.
Ah, okay. So it's literally affecting the lung structure, the tissue itself, not just the empty spaces for air.
Precisely. The sources explain it generally starts with some kind of injury.
An injury.
Yeah, to the cells lining those air sacs, or maybe the tiny blood vessels right next to them. And that injury, well, it can be kicked off by various things. Infectious agents are definitely on the list.
Okay, so an injury triggers inflammation right inside the lung tissue. What happens then? What's the fallout from that internal fight?
Well, that damage and inflammation, if it goes on, can lead to chronic changes. The biggest one, often, is fibrosis.
Fibrosis. That's scarring, right?
Exactly, scarring or thickening of the lung tissue. And over time, you can also get a buildup of inflammatory cells, other structural changes. Basically, it makes the lungs stiff, less flexible.
And less able to do their job, I imagine.
Right. Less efficient at oxygen exchange.
Fibrosis. That sounds like it could be a permanent issue. Which parts of the body are mainly hit by this? Is it just the lungs?
Primarily, yes, it's the respiratory system, the lungs themselves. That's absolutely where the disease is centered.
But I think I saw the sources mention another system could get involved.
You did, yeah. The cardiovascular system can definitely be affected, usually as a complication down the line.
How so?
If the lung disease becomes chronic and severe, it can lead to something called cor pulmonale. That's basically right-sided heart failure.
Oh, wow.
Yeah, it's caused by high blood pressure and the vessels going to the lungs. The heart just struggles to pump blood against all that resistance from the damaged lungs.
That makes a lot of sense. The heart and lungs are so closely linked, aren't they?
Totally.
Okay, so let's switch gears slightly. Who gets this? Is there a pattern? Is it just random bad luck?
Well, the sources definitely point to risk factors. And sometimes there's even a genetic connection.
A genetic link? Really?
Really?
For which types?
Idiopathic pulmonary fibrosis, IPF, is a key example. The sources are pretty clear. There's a breed association,
Which breeds?
specifically West Highland White Terriers, and other terrier breeds seem predisposed too.
Ah, Westies.
Yeah, but while they know these breeds are at higher risk, the specific gene hasn't been identified yet, according to this material.
So those little Westies might just be born with a higher chance of getting this lung scarring. That's a really important takeaway. What about, like, how common it is overall?
Well, the overall incidence, the prevalence, the sources describe it as incompletely understood.
So not easy to track.
Seems not, yeah.
And what about geography? Does it matter where a pet lives?
Oh, absolutely.
Wow.
Especially if the cause is infectious. The sources give some pretty striking examples here.
Like what?
Certain lungworms, like Allurostrongylis abstrusis or Angiostrongylus obzorum, they have specific geographic distributions. You find them more in Europe or parts of the Americas, Australia, Africa. It depends on the specific parasite.
Right. So where you live, or maybe where a pet has traveled, could be a real clue. Any other geographic links that stood out?
Well, Leishmania gigassi is mentioned for South and Central America, and maybe a bit surprising, the sources link H3N2 influenza outbreaks specifically to China, and interestingly, Chicago in the U.S.
Chicago. Wow,
Yeah.
that's specific for a flu strain. Okay, so Beyond geography and genetics, what about age or other breed risks for different types of this condition?
This is where it gets really quite specific, actually. Canine distemper virus, that's a classic cause.
Right.
It tends to hit younger dogs, usually around 3 to 6 months old. And even then, certain breeds seem more susceptible to getting the pneumonia form of distemper.
Ooh, which ones?
Greyhounds, Siberian Huskies, Weimaraners, Samoyeds, and Alaskan Malamutes are all listed.
That's a very distinct list of breeds for distemper lung issues.
Yeah. Then you've got other things like endogenous lipid pneumonia. That's apparently seen more often in older cats, either sex.
Older cats?
And pulmonary interstitial lung disease, which is different from IPF, that's described in middle to old-aged Westies, but also sometimes Cairn or Bull Terriers.
So Westies pop up again there.
They do. And there's a feline version of idiopathic pulmonary fibrosis-like disease that affects middle-aged to older cats, too.
It definitely sounds like being middle-aged or older is a kind of general risk factor for several of these types.
It really does seem that way. Oh, and another interesting one, Pneumocystis jirovecii pneumonia. That specifically affects miniature dachshunds under a year old.
Dachshunds, okay.
And Cavalier King Charles Spaniels. And then toxoplasmosis pneumonia is noted more often in middle-aged male cats.
Male cats specifically. Interesting.
Yeah, it really shows how the who gets it depends so much on the what's causing it.
That level of detail on specific breeds and ages.
Yeah.
That's really powerful info for owners and vets listening. So, okay, if a pet falls into one of these risk groups, or even if they don't, what are the signs? What might clue you in that something's wrong?
Well, the signs can vary quite a bit depending on how severe things are, but there are some common themes.
What would an owner typically notice first, do you think?
Owners often report tachypnea that's just fast breathing.
Okay.
Coughing is common too, generally having difficulty breathing, maybe getting tired really easily, like exercise intolerance. They just can't manage their usual walk.
Right, they just seem wiped out much quicker. And what might a vet pick up on during an exam?
So on the physical exam, a vet might actually see them breathing with their mouth open. They might hear abnormal sounds in the lungs, crackles when they breathe in or out.
Crackles?
Yeah, sometimes described like crinkling plastic wrap, that kind of sound. In really severe cases, you might see orthopnea. That's where the pet can only seem to breathe comfortably sitting up or standing with their chest raised.
Oh, dear.
Or even cyanosis, that's a bluish tinge to the gums, means they're really low on oxygen. Less common, but possible, is hemoptysis, coughing up blood.
Okay, those are definitely get to the vet immediately signs. Are there any specific signs that might point towards one particular cause over another?
Yeah, the sources mentioned a couple of really striking ones. Paraquat toxicity, that's from ingesting a specific nasty chemical.
Right.
It causes vomiting, peeing less, diarrhea, even ulcers in the mouth. And apparently early on, you might even see them being hyperexcitable or showing neurological signs.
Yikes. Nasty stuff.
Very. And then with toxoplasmosis as the cause, the signs aren't always just in the lungs. You might see eye inflammation, retinitis or uveitis, neurologic signs again, GI upset. It's a good reminder that lung problems can sometimes be just one part of a bigger systemic illness.
That definitely makes sense.
Yeah.
Which brings us, I guess, to the million-dollar question, what causes all this? Given how varied the signs are and who gets it, I'm guessing the list of potential causes is pretty long.
Oh, it is. It really is. And the source material is incredibly comprehensive here. It highlights just how many different roads can lead to interstitial pneumonia. The causes kind of fall into several big categories.
Okay, let's maybe walk through the main ones.
Sure. So you can have congenital causes, things the animal is born with, maybe certain structural lung problems that then lead to inflammation.
Okay, born with it.
Then there are metabolic issues, problems elsewhere in the body that affect the lungs, like kidney failure causing uremic pneumonitis, or issues with the liver or pancreas, especially noted in cats.
Interesting. So not just lung problems causing lung problems.
Exactly. Even neoplasia, cancer can sometimes be involved, maybe leading to secondary inflammation.
So it's not just infections then?
Oh, far from it. You've got inflammatory causes, where inflammation is kind of the main driver, sometimes alongside other things like bronchitis. And then there's a really big category, idiopathic conditions.
Danny.
Meaning the cause is simply unknown, like that idiopathic pulmonary fibrosis, IPF we mentioned, just happens. And some other specific types fall under idiopathic too.
Wow, that must make diagnosis incredibly challenging.
It absolutely can. And then as we sort of touched on, infectious causes are a huge group. The list here is long and varied.
Okay. You've got Viruses like canine distemper or influenza, parasites like those lungworms, Illura strongylus and Jatia strongylus or toxoplasma, even other organisms like leishmania or pneumocystis.
Wow, the range is incredible. From common viruses to parasites you might not even think about.
It really underscores why a thorough diagnostic workup is so important. Then you have toxic causes, too.
Like the paraquat.
Exactly. But also things like inhaling dusts, gases, vapors, even certain medications like thiacetarsemide are mentioned. And finally, vascular causes, things like blood clots traveling to the lungs or damage from worm larvae migrating through the vessels.
Good grief, that list is exhaustive. It really drives home why figuring out the why is so critical and probably pretty complicated. So what are the steps? How does a vet actually sort through all these possibilities?
Well, the diagnostic journey usually starts by ruling out other conditions that can look similar, sometimes things that are maybe more common.
Like what sort of things? Things like general airway disease, maybe straightforward bacterial bronchial pneumonia, heartworm disease. Yeah. Even primary heart disease. They can all cause coughing or breathing difficulty, right? So you need to consider those first.
Okay, rule out the usual suspects. Then what? What specific tests are needed for interstitial pneumonia?
Basic lab work is usually a starting point. Blood cell counts, the CBC, and biochemistry panels.
What can they tell you?
They can give clues. For instance, changes in specific white blood cells might point towards inflammation or maybe a parasitic infection. If the pet's been low on oxygen for a while, their red blood cell count might go up.
Ah, the body trying to compensate.
Exactly. And specific findings can sometimes hint at certain causes, like low platelets might suggest angiostrongylus. Changes in liver enzymes could point towards toxoplasma or maybe certain toxins.
So the basic blood work can definitely start pointing you in certain directions. What about checking lung function more directly?
Yeah, an arterial blood gas test is really key here. It measures the oxygen and carbon dioxide levels right in the arterial blood. The sources mention that a low oxygen level, a PaO2 below 80 millimole Hg, indicates hypoxemia, not enough oxygen. And they also talk about something called the A gradient.
The A gradient, that sounds technical. What is that?
It's basically a measure of how well oxygen is moving from the air sacs, the alveoli, into the bloodstream. If that gradient is high.
Meaning a big difference between oxygen in the sacs and oxygen in the blood.
Right. It suggests there's a problem with that transfer. The lungs aren't working efficiently, even if the air the pet is breathing has plenty of oxygen. The source notes an A gradient over 15 is considered abnormal.
Got it. So the oxygen just isn't making the jump effectively. What other tests are in the toolkit?
Well, specific tests for infectious agents are obviously crucial. Blood tests for viruses or leishmania, a specific fecal test called a Behrman to look for lungworm larvae, even toxicologic tests on urine or serum if poisoning like paraquat is suspected.
Makes sense. And imaging. What about X-rays or CT scans? What do they show?
Thoracic radiographs, chest X-rays are really important. They can show different patterns in the lungs. Vets look for things called interstitial patterns, which is that inflammation in the tissue space we talked about earlier.
Okay.
They might also see signs of secondary problems, like an enlarged heart or pulmonary artery if that lung high blood pressure is developing. CT scans give even more detail.
I thought bitches.
Yeah, much more detailed. They can show patterns like ground glass opacification or thickening around the airways. And the sources make a really good point. CT is particularly helpful before doing a biopsy because it can help pinpoint the best area to sample.
Ah, guide the biopsy. That makes sense. Speaking of biopsies, how definite are these diagnostic procedures? Can you be sure?
This is actually a really critical takeaway from the sources. While all those tests the labs, the imaging give valuable clues. An open lung biopsy is often required for a definitive diagnosis of interstitial lung disease.
Required? Wow, that sounds like a pretty major procedure.
It is, yeah, but it's often the only way to truly identify the specific type of interstitial disease and sometimes the underlying cause by actually looking at the lung tissue under a microscope that's histopathology.
Okay, so biopsy is the gold standard for really knowing what you're dealing with. Are there less invasive things that can help?
Yes, sometimes. Procedures like airway washes, collecting fluid from the airways, or using a scope to look inside, that's bronchoscopy with a BAL, or bronchial alveolar lavage.
Right.
Those can sometimes find specific organisms like pneumocystis or lungworm larvae, maybe toxoplasma, or they can identify secondary bacterial infections if you culture the sample. Oh, and the sources mention that with one specific condition, PEP, the wash fluid is noticeably opaque and white.
Interesting detail. So less invasive tests might catch some causes, but the biopsy is really needed to classify the disease type itself. What do those biopsies, those tissue samples actually show? What are they looking for?
This is where the sources get really detailed and kind of fascinating about what different causes actually look like microscopically. For example, with that lungworm, Ilurostrongylis, the lungs might literally have greenish nodules you can see. And under the scope, you see the larvae and eggs causing all this inflammation.
Green nodules. Wow.
With the other lungworm, Angiostrongylus, you see damage and clots, thrombi, in the lung's blood vessels. For a condition called BOP, you see these characteristic plugs of tissue blocking up the small airways.
Tissue plugs. Those are incredibly vivid descriptions.
They really are. They're like signatures of the problem. Idiopathic pulmonary fibrosis in Westies, it shows diffuse scarring, often near the edges of the lungs. The feline IPF-like disease also shows scarring, but interestingly, the sources note it often lacks the heavy inflammation seen in some other types.
Oh, different pattern in cats.
Yeah. Lipid pneumonias, they show white nodules filled with fatty stuff. Paraquat toxicity causes these heavy, swollen, often bloody lungs. Each cause really leaves its own unique fingerprint at the microscopic level.
That insight into what the disease physically looks like in the tissue really helps connect the dots between cause and effect.
Okay.
So we've defined it, we've talked causes, we've talked diagnosis. How is this actually treated? What can be done?
Well, treatment is definitely complex, and it hinges heavily on trying to identify that specific underlying cause, if possible. But supportive care is almost always a starting point.
Meaning?
Pets in respiratory distress, they often need to be hospitalized. They'll likely need oxygen therapy to help them breathe easier.
Okay, stabilize them first. What about managing it longer term?
Minimizing exposure to things that could irritate the lungs further is really important. You know, dust, smoke, chemical fumes. Sometimes humidified air can help soothe the airways. For one specific condition, PAP, they mention therapeutic lavage, basically washing out the airways to remove the built-up material.
Right.
And of course, if a secondary bacterial infection pops up, which can happen, then antibiotics are needed based on culture results.
What about their activity level?
Exercise restriction is usually key. You don't want them overexerting their compromised lungs. Using a harness instead of a neck collar is also generally recommended, less pressure on the airway.
Good tip.
And, like with many conditions, if the pet is obese, weight loss is important to reduce the workload on their breathing.
What should owners kind of brace themselves for in terms of treatment goals?
That's a really important point. The sources note that for many of the chronic or severe forms, treatment is often palliative.
Palliative.
Yeah, meaning the main focus shifts towards managing symptoms, controlling the signs, and trying to maintain the best possible quality of life, rather than necessarily aiming for a complete cure, which might not be realistic.
Okay, that's an important distinction. What about medications? I assume they play a big role.
Oh, absolutely. Medication is a major component, usually aimed at reducing the inflammation and trying to make breathing easier.
What kinds of drugs are typically used?
Often, inhaled corticosteroids are a cornerstone. They're given using a special spacer device and a mask, which helps deliver the anti-inflammatory medicine directly into the lungs where it's needed.
Ah, targeted delivery.
Exactly. And bronchodilators are also very common. These drugs help to open up the airways, relax the muscles there, and reduce the effort of breathing. The sources list specific examples like theophylline, which is often given as an extended release pill, or terbutaline. Inhaled bronchodilators are used too.
And are there specific drugs for specific causes, like those parasites or other infections we talked about?
Yes, definitely. If a specific infectious agent is identified like lungworms or leishmania or pneumocystis, then targeted antiparasitic or antimicrobial drugs are used. The sources provide specific drug names, dosages, and treatment durations for these.
Right.
And often, corticosteroids might still be used alongside those specific treatments to help manage the inflammation caused by the infection.
Right. Tackle both the bug and the body's reaction. What about that really tough one, the idiopathic form, IPF? Is there anything specific for that?
That's the really challenging one. The sources state pretty clearly that there is no effective therapy, specifically for idiopathic pulmonary fibrosis in pets.
No effective therapy.
Yeah. They do mention a drug called pirfenidone, which is used in humans with IPF, but according to this material, it hasn't really been investigated yet in veterinary patients.
That really underscores the difficulty with IPF, doesn't it?
It absolutely does. So beyond those specific treatments, general anti-inflammatory steroid therapy, usually with oral prednisolone, is very commonly used across many types of interstitial pneumonia. Sometimes cough suppressants or antibiotics are added in as well, depending on the case.
And for something really acute and severe, like that paraquat poisoning.
Yeah, for paraquat, treatment is largely supportive care. If it's caught extremely early, like right after ingestion, they might try to induce vomiting or give activated charcoal to limit absorption.
Right.
But otherwise, it's mostly about supporting the animal fluids, oxygen, managing symptoms while the lungs are incredibly damaged. The source does mention using diuretics and potentially even immunosuppressive drugs like dexamethasone or cyclophosphamide in those cases, though the benefit is probably limited.
It sounds like there could be a real balancing act with some of these medications, especially the steroids.
There definitely is.
Yeah.
That's a key precaution mentioned. Using immunosuppressive drugs like high-dose steroids needed to control inflammation can unfortunately make a pet more vulnerable to developing secondary infections,
Ah,
which is obviously a major concern when you're already dealing with compromised lungs. You're dampening the immune response, causing the inflammation, but you're also potentially lowering their defenses against bacteria or other bugs.
that makes total sense. It's a tricky trade-off.
Uh,
Okay, let's sort of round things out now with follow-up, prevention, and the big picture, the prognosis. What happens after diagnosis and starting treatment?
Monitoring becomes really critical. Owners play a huge role here, observing their pet closely at home. Are they breathing easier? Is their breathing rate faster or slower? How's their energy level?
So, owner observation is key.
Hugely important. And then follow-up vet visits are crucial too. That involves repeat physical exams, carefully listening to the lungs again, probably repeating chest x-rays to see if the patterns are changing, and potentially repeating blood tests or even that arterial blood gas analysis to objectively track progress.
Okay. And what about trying to prevent this whole thing from happening in the first place? Is that even possible, given all the causes?
Well, for some causes, yes. Prevention really focuses on avoiding the known risk factors where you can. Like the sources emphasize. Avoid exposure to toxic fumes, chemicals, definitely paraquat if possible. Regular vaccination against things like distemper and routine deworming are absolutely fundamental preventative steps, especially targeting those infectious causes we discussed.
Basic wellness care, essentially.
Exactly. Good parasite control, including for insects and rodents, can help prevent exposure to parasites they might carry. Oh, and interestingly, the sources also mention preventing pets from eating potential intermediate hosts, things like frogs, lizards, rodents, birds, as a way to stop certain parasitic life cycles.
Huh. Don't let Fluffy eat the frog. Got it.
Yeah.
Good practical tips there. What are the potential complications that pets with interstitial pneumonia might run into, even with treatment?
Well, beyond the progression of the primary lung disease itself, those secondary pulmonary infections are a really major risk, especially, as we said, if the immune system is suppressed by the disease or the treatment.
Right, secondary infections. Anything else?
Developing pulmonary hypertension, that high blood pressure in the lungs we talked about earlier, is another serious potential complication that can further strain the heart.
Okay. And now, the question that's probably been on everyone's mind throughout this. What's the likely outcome? What's the prognosis, generally speaking?
Unfortunately, for many forms of interstitial pneumonia, the prognosis is quite serious. The sources consistently describe it as guarded to poor.
Guarded to poor.
Yeah, especially when it's caused by certain infectious agents or conditions like uremic pneumonitis that stem from severe kidney failure.
That doesn't sound very hopeful for those specific cases.
It reflects the severity of the underlying issue and the real difficulty in treating them effectively. And for idiopathic pulmonary fibrosis, that condition with no known cause, the long-term prognosis is also stated as poor.
Poor for IPF, too.
Yes. The sources even give some sobering average survival times based on studies. For dogs with IPF, it was around 17 months. But for cats with the feline-specific IPF-like disease, it was significantly shorter, only about 5.5 months on average.
Wow, that stark difference between dogs and cats with those idiopathic forms. That's a really surprising and, frankly, quite grim detail.
It certainly stands out. And sadly, for paraquat toxicity, the sources state it's commonly fatal in dogs. Just very difficult to overcome once the damage is done.
This has really been quite a journey, hasn't it? Through some incredibly dense and complex information.
Yeah.
We started down at the level of tiny injured structures within the lung.
Yeah.
Worked our way through that massive list of potential causes, the really intricate diagnostics that are needed, the challenging treatment options, and landed here with Sadly, often a very guarded prognosis.
It truly shows just how much goes into understanding, diagnosing, and trying to manage veterinary interstitial pneumonia. And it highlights how different the approach and the outlook can be depending on the specific cause, which our source material made abundantly clear.
Absolutely. So just pulling all this together for you, the listener, thinking about this huge range of potential triggers from infections you might never have considered to toxins to genetics, and even those frustrating cases where the cause just remains unknown. And then considering the often very serious or even poor prognosis, especially for conditions like IPF, what does all this complexity, this outcome landscape, really underscore about the value of those foundational things? Preventative care like vaccinations and deworming, controlling exposure where possible, or maybe the absolute critical need for vets to take a really detailed history and perform a thorough, sometimes extensive diagnostic workup, even when the sign is something seemingly common, like just a cough. It really highlights how that single symptom could be the tip of a massive iceberg, representing vastly different, often very serious underlying issues, each demanding its own specific and often urgent investigation.